What should my oral hygiene regimen be?
That's a really good question, Sasha. Thank you for asking that. That's a very common question I get asked by my patients. Everyone wants to know, which toothbrush they should use, how many times should I brush a day, how many times should I floss a day, should I floss before I brush, should I floss after I brush. There's a lot of confusion around, what patients should be doing when they're at home. Basically, the most important thing is that you should come to see a dentist every 6 months. It's so important for a dentist to be able to take a look in your mouth and check to make sure that you don't have any cavities, or to check, really look to see if there's any problems developing. And for dentists, the most important thing is prevention. If we can prevent something from happening when something is small in your mouth, then we can save patients a lot of money, time, and effort. The reason why a patient should brush twice a day is because plaque actually builds up every 12 hours. The reason why you should floss every day is because what flossing actually does, people ask me, why should they floss? What flossing actually does is it mixes up the bacteria. People think that, when they floss, they're getting plaque out of their teeth, or they're getting food debris out of their teeth. All of this is true, but in fact, the reason why people should floss is because the bacteria can only make toxins when they start to group together and colonize. Only when they can group together, they can produce toxins. And when that happens, those toxins is what's actually causing damage on the teeth. It's what's causing damage in the gums. The toxins that's released from the bacteria after they can group together is actually what's causing decay in the mouth, or it's what's causing gum disease.